Hello, I read the book by Jonathan Bush, Where Does It Hurt? The first thing I'm going to talk about is building partnerships. Jonathan Bush, the author of Entrepreneur's Guide to Fixing Healthcare, Where Does It Hurt?, talks about his failed business early on in the book. In the 1990s, he started a birthing center that focused on midwives opposed to physicians. Jonathan failed to build partnerships, which is one of the reasons his business failed. However, Jonathan did build partnerships and has excelled in his healthcare data system startup that he did years later. Building partnerships involves the ability to build mutually beneficial business relationships that create improved business outcomes. Partnerships imply a sense of cooperation rather than competitiveness and looks for balance within the established relationship. Effective partnerships take a long-range approach and recognize the nature of give and take based on the current needs of the organization. At times, imbalance may occur, but overall, successful partnerships are maintained because all partners receive great benefit from the relationship. Competency examples of building partnerships include responding to the needs of customers and stakeholders in a timely manner, working with outside colleagues to foster the transfer of process information, which leads to business improvement in both directions, sharing experiences and expertise with contacts in other organizations, creating and leading cross-organizational teams to look at new business opportunities. There's a report that I found, a partnership between Gretna, Louisiana and Jefferson Council on Aging and People's Health, a physician-owned Medicare Advantage HMO has built a partnership between the two. The partnership produced a senior wellness center. Carol Solomon, who's the CEO of the People's Health, stated that seniors can get nutritious meals at the center, take music classes, and even practice yoga. Solomon's mission is to improve Louisiana's health through community service and initiatives as a leader of People Health, which she has been doing for the last 15 years. In 2012, Solomon started an alliance between the insurer and Louisiana State University Health Sciences Center in New Orleans to create the Center of Healthcare Advancement. The Center's Advisory Council assembles best practice for treatment and prevention of the most common chronic conditions in Louisiana, such as diabetes. The best practices are then shared with physicians in the insurers network and Louisiana State medical students. Solomon's work is personal, she states. She said that we live and work in the community, and we feel like people we take care of, our neighbors, our friends, and the people we see at the grocery store and church. So building partnerships is extremely beneficial to both parties when they're done right, and they can help, and the community can benefit from the partnerships as well. The second topic is business knowledge. Again, Jonathan failed at his delivery practice in San Diego because he failed to know the ins and outs of the birthing business. He didn't have a real business knowledge sense. Jonathan did his homework the second time around and had tremendous business again with his healthcare data industry. He took the time, he learned the knowledge of the business and the business field, and he got it right the second time. Business knowledge means having the business expertise needed to drive strategy, evaluate, and improve performance. Those who do not possess a solid understanding of business and operating at a disadvantage if their understanding does not improve. By using the process landscape is a tremendous way for gaining knowledge about the business. Processes are mechanical at first, and over time, significant understanding how a business is constructed is gained. The business knowledge competency examples include obtaining general knowledge in all areas of the business, applying cross-functional knowledge to solve concrete business problems, understanding the market, customer base, and environmental factors of the organization, outlining the various business goals and how they can be obtained. It is important for the healthcare organizations to set realistic business goals for its employees. Several studies suggest that pressure from management to meet unrealistic business objectives and deadlines is the leading factor most likely to cause unethical behavior. 70% of employees identified such pressure to meet unrealistic business objectives as most likely to cause them to compromise their ethical standards. The third topic topic I'm going to look at is strategic planning. Jonathan met with directors at a large pediatric hospital when he had the data software company. The pediatric hospital was looking at buying pediatric practices in the area. Jonathan told them not to and to focus their attention on buying a jet. This pediatric hospital specializes in atrial septic defect. Surgery to repair an ASD can cost more than $100,000. Jonathan tells the directors to give a 20% discount and to make their facility available to every child in a 1,000-mile radius from the hospital. He suggested the jet so the jet could pick up these patients that could benefit from the surgery and bring them to the pediatric hospital. We have seen this strategic planning here at Langstroth General here of late. Langstroth General Health has joined Penn Medicine. This is strategic planning on both sides of the organization. Strategic planning is an organization's process of defining strategies and directions and making decisions on allocation of its resources to pursue the strategy, including its capital and individuals. Strategic planning is the formal consideration of an organization's future course and gathers senior leaders, managers, and any necessary process owners within the organization in order to determine its strengths, weaknesses, opportunities, and threats. Obviously, strengths are characteristics that give the organization advantage over other organizations. Weaknesses are characteristics that give the organization a disadvantage over the other organization. Opportunities is items that organization could exploit to the organization's advantage. Threats can be classified as items in the business world environment that could cause difficulty for the organization. There are multiple issues that can negatively affect strategic planning. These problems fall into seven general categories. Failure of executive leadership, problems in the organizational culture, exclusion in the process, failure to integrate planning with the operations of the organization, poor execution, incorrect or poor metrics and goals, too much formality and structure in the planning process. Another topic that I focused on while I was reading the Where Does It Hurt by Jonathan Bush, he explored ecosystems in healthcare. One chapter he talked about how hospitals are merging together. Research hospitals are buying local healthcare practices. One specific example that Jonathan gave was Duke University Health System were buying all the cardiology practices in the area. Duke specializes in cardiology, so they wanted to make sure that they kept up with the demand, and they wanted to be the only game in town. Process ecosystem is the management of an enterprise as an integrated network, which all processes and related attributes are interconnected and driving toward business success. Process ecosystems also provide clear visibility into all of organizations' processes, predicts future state process and technology needs to ensure sustainability, reduces the time, cost, and the resource strain of process improvement activities. Process ecosystem components, strategic goals. There are planned objectives that the organizations want to achieve. Policies are basically principles and guidelines. Processes, series of activities to achieve the outcome. Procedures are specific instructions to perform the steps or the activities. Key performance measures, set of indicators, key points along the process. These key performance measures data allow stakeholders to analyze performance and make adjustments. In healthcare, it is crucial for organizations to provide extraordinary care, and to do so, stakeholders must analyze the performance that is given. Another component is process dashboards and scorecards. They're visual indicators of historical trends. Personas, detailed descriptions of customers and users of a process. Resources, components needed to carry out the process. Risks, or any factor that may interfere with the process. Business rules, statements that define and control aspects of the business. And finally, the last one is relationship-based care. In the book, Jonathan talks about Boeing, the airplane maker. They were self-insured, their staff members. Their healthcare bills were rising, and this hurt them in the business sense. The focus went to the employees that were costing the business the most in healthcare costs. 2 physicians were hired, and they studied Boeing's healthcare patterns, and it was learned that the chronically ill employees and their family members represented a unique opportunity. They said to fix this unhealthy and costly pattern, Boeing would spend money to keep the patient out of the hospital. They took a proactive approach. The most effective way to do this was to make lifestyle management changes and teach them about diets, how to read nutritional labels, and how to manage stress. The focus was on relationship-centered care. They wanted the employee, well, not the employee, but the patient to drive the bus as far as making decisions. They gave them the information, and it was ultimately up to the patient to make those correct choices, healthy living choices. And soon after implementing these techniques, the rate of admission to the hospital declined. These individuals had improved working and personal lives. So what happened was it worked. Relationship-centered care focuses on partnerships at every level and the respect, mutual understanding, and shared decisions making of which partnerships is compromised. Relationship-based care has 7 dimensions that surround the patient and the family. Those 7 dimensions are a caring and healing environment. Patients are involved in their own care. Leadership, healthy relationships and caring behaviors are led by the leaders. Teamwork, open and honest communication is a cultural norm. Professional practice accountability is understood and embraced by all healthcare team members. Caring delivery, there's an acceptance of the responsibility for relationships with patients. Resources, effective prioritization is present, and outcomes, evidence and measurement are used to celebrate success. So those are my 5 topics that I focused on while I was reading this book. It was a very great book. I learned a lot, and I recommend it to whoever has time to read it.